any foreign material that you put inside the body, hence foreign body, the body will create a scar around it. And because it's inside the body, we call it a capsule. Basically, it's a three-dimensional scar that separates between the foreign material and the body tissues. If the capsule is what we call normal, it's soft and it's very thin. But sometimes, for reasons that we don't fully understand, this capsule becomes thick and starts to contract. And it retracts the breast tissue with it, eventually causing a deformity of the breast. This contraction process can also retract or compress nerves, and that will cause new onset of chronic or intermittent pain. It can be a shooting pain, it can be burning pain. This pain can come and go, or it can be constant. This is called capsular contracture. It starts to happen around several months after the procedure, and as we go further away from the procedure, the percentages of capsular contracture go more and more up. How do we treat capsular contracture? Basically, it's another surgery where we either score it or completely remove it, and then we decide whether to put the implant back or replace it with something else. Today, the only thing that we can augment the breast besides implants is fat. We get the fat using liposuction, and then we process it and re-inject it into the breast. So capsular contracture doesn't usually cut the nerve supply, but it does compress the nerves. Nerve compression can cause chronic pain, and it can also cause reduced sensation, numbing sensation, and mostly pain. Current theories about capsular contracture is that it caused because of a silent contamination around the implant during the procedure itself or later. Therefore, a lot of plastic surgeons switch to putting the implant deeper under the muscle in order to make a bigger barrier between the skin that harbors bacteria and between the implant. This silent contamination, according to the theory, causes chronic irritation of the tissue around and the scar around. This chronic irritation creates constant creation of scar. And this is the present theory. There were some studies that supported it. They found some bacteria genome in some specimens of capsular contracture breasts. Also, some theories says that implant rupture increases the chances of capsular contracture because of the constant irritation of free silicone inside the capsule, but these theories are still to be completely proven. So the risk of capsular contraction, for what we know today, is more about the shell of the implant. For many studies that were done in the 90s and 80s, the rate of capsular contracture was very high, especially in smooth shell implants. And then a new generation of implants was developed that included a textured implant. The textured implant basically reduced the rates of capsular contracture tremendously. So if you ask me another question and say, so why aren't we using textured implant in the United States and we only use the smooth ones? The answer is a new disease called ALCL that was associated with textured implants. And that's on another video.